I'm Jeff Rockmore. I am first and foremost a dad, but also I'm a plastic surgeon here in Albany, New York. I've lived here most of my life, and my family's from here, many generations, and I never wanted to leave my family. So I haven't really made it that far, actually. Stayed around, and I don't know that I ever could leave my family. They're the most important thing to me in my life. After medical school, back when I went through training, you had to do a full 5 years of general surgery. So I got board certified in general surgery and learned a lot, took care of a lot of trauma, a lot of sick patients, and did everything from chest surgery to colon surgery and everything in between. So I think that those years gave a tremendous experience in terms of number of operations and understanding the body, understanding sick people, how to really take care of them. And then I did a plastics fellowship afterwards. And thereafter, I did my cosmetic training in Manhattan. There's really only one true American Board of Plastic Surgery, and that means you've fulfilled a very strict set of criterion. There are boards of facial plastic surgery and cosmetic surgery and almost anything else where you can send in a set amount of money and get a nice certificate to hang on your wall. But with the American Board of Plastic Surgery, there's a rigid criterion of what the training is, exams that you have to take and pass to get through, and also maintain your continuing education. So it's closely monitored. There's not a lot. I think that you really have to bear down and read and be 100% devoted to it and committed to it, because what you get out is truly what you put in. And I think there's a lot of ways through it. I think you can get through it the easy way and kind of skate through and do the bare minimums. But I think if you really want to live up to what I think is your responsibility, which is ultimately to the patient, then you should give it your all. I've been in practice for 20 years. Before that, I was in training for 8 years. So a lot of people quote the number of years that they've been a doctor. I think it's a little bit more relevant to say how many years you've been in practice. And I've been practicing for 20 years. I think people come to see me for a lot of different reasons. And I think that we all have something that we maybe are unhappy about or that bothers us a bit. And I think that as a society, we probably don't talk about body image enough. I think body image is tremendously important in how it impacts the rest of our life. We all wake up and have something that bothers us, but sometimes it bothers us to the point where when you wake up every day, you notice it, you start your day off in a bad mood and you're self-conscious about it. And I see a lot of people that are self-conscious about things that may not be even noticeable to anybody else, but it's important to them. Now, I think when you come out of your training, residency and fellowship, you've got this font of knowledge. You probably have a broader knowledge than you'll ever have at any time in your life. But it's not practical knowledge because you've never really followed through patients. You've seen a lot of operations, but you haven't done the preoperative care and the postoperative care and learned how to actually talk to people. And everything evolves. I think that when you're exposed to a lot of different surgeons in your training, you can kind of pick a little piece from everybody of what you like and what you don't like and come up with your own style. And I think that certainly in my field, the plastic surgery, the aesthetic eye is different. Everyone has different things that they find appealing. So it's coming up with a style that kind of gets the results that you think are natural. And, I err towards the side of natural. That's what I like. I like natural beauty, and I think there's plenty of it around. But I also think it's important to critically look at yourself and the results. I'm always looking to do it better. So if I looked at how I do a facelift now versus how I did a facelift 20 years ago, they're almost entirely different procedures because we continue to look at the results and tweak and make subtle little adjustments to get improvement. And that's something that I continue to do. It's, I want to continue to evolve to get better results, have happier people. And I think that one of the things that I really try to focus on or spent a lot of time evolving towards is trying to disarm them so that they feel comfortable talking. And I think that's a real hard thing to do. I mean, I can't imagine that that's comfortable. We all have things that bother us. I certainly have many things that bother me about myself. And the thought of talking about that with a perfect stranger, I think, is really difficult. So that's by just kind of talking and getting to know people as a person. I think that can help a lot. I think you really have to care. And I think that you have to be genuine. And I think that people can tell the difference. And, the day I stop caring is the day I stop working.